Welcome to 92NY's Women's Health Summit. We've convened leading doctors, experts, authors, and more to equip women and girls with the knowledge and power they need to lead their healthiest, happiest, most fulfilled lives. I want to thank our sponsors, Northwell's Katz Institute for Women's Health. This week, we'll explore the most essential things women need to know about health and wellness and provide advice on how to take the best care of ourselves. We'll find out about the most interesting new approaches to physical and mental health, and we'll examine important topics like heart health and brain health. 92NY is proud to present today's event as part of our long-standing commitment to uplifting women and girls. Thank you for joining us.
Thank you for joining us today for the 2022 Women's Health Summit. I'm Dr. Stacey Rosen, the Senior Vice President for Women's Health at Northwell Health and Professor of Cardiology and the Partners Council Professor of Women's Health at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. I oversee the Katz Institute for Women's Health, and we are thrilled again to partner with the 92nd Street Y to present this week's Women's Health Summit during National Women's Health Week. In celebration of this observance, led by the U.S. Department of Health and Human Services Office of Women's Health. We're excited to share important information you need to make your health a priority and to take better care of yourself and your loved ones. This event would not be possible without the generous support of Nancy and Larry Roth. We thank them for their continued support of women's health because events like this are at the core of the Katz Institute's mission. We aim to make women better advocates for themselves by sharing knowledge and resources, and that's exactly what this week is all about. Historically, the model for healthcare, for research, for clinical practice, has been man. This has shaped medical research, medical standards, symptom definition, diagnosis, and treatment. But Northwell is dedicated to raising the health of everyone in our community, including raising the standard of care for the 51% of the population who have been underserved, underrepresented, unseen, and unstudied for so long. At the Katz Institute for Women's Health, we're raising the health of women by building a network of experts devoted to every aspect of women's health. Our clinicians and researchers take women's norms, women's needs, and women's patterns of disease and health to deliver women-centered care across all stages of a woman's life. We not only see women's health differently, but we have the expertise to treat women differently, whether it's prevention, diagnosis, or sex and gender-focused treatment. And this couldn't be more important because we also know that women serve as the chief medical officers of their homes and communities, which means that healthy, well-informed women lead to healthy, well-informed families and communities. Throughout the Women's Health Summit this week, our experts will be sharing the latest information on women's health issues, the most essential things that you need to know about your own health and wellness, and advice on how to take the best care of you yourself. We begin this week's program with a discussion on mental health, which can impact our physical health in so many ways. Women can be so busy taking care of others that they put their own healthcare needs last. Today, we'll explore the everyday stress of caregiving and the importance of taking care of yourself in the process. Plus, we'll dive into what all women need to know about alcohol consumption, the health benefits, as well as the potential risks. Keep celebrating National Health Week with us. Join us again tomorrow, May 11th, for a day on the heart-brain health connection, and again on May 12th for gynecologic and breast health. Thank you for joining us today and for celebrating National Women's Health Week by prioritizing your health. I look forward to continuing to elevate women's health throughout the week. Thank you.
Hello, and welcome to the Women's Health Summit. My name is Linda Henry, and I am so excited about our conversation today on prioritizing your care because we have the best possible expert to lead us on this, Dr. Jennifer Ashton. Hi, Jen.
Hi, Linda.
You may recognize Dr. Jen as ABC's News Chief Health and Medical Correspondent. As part of the ABC News Medical Unit, she reports on major health and wellness issues across all of ABC News platforms. She also reports on the latest breaking medical news for the two-time Emmy-nominated show GMA3, What You Need to Know. Dr. Ashton has been at the forefront of the ABC News COVID-19 coverage, which has really been a comfort to all of America. She has been visiting with the NIH Vaccine Department Lab, the CDC, the White House, meeting with VP Pence and the White House Coronavirus Response Coordinator Dr. Deborah Birx. Dr. Ashton has also interviewed the National Institute of Allergy and Infectious Diseases Director, Dr. Anthony Fauci, as well as Dr. Rochelle Walensky. She is double board certified in OBGYN and obesity medicine. She has a master's degree in nutrition, making her the only physician with a national media platform who is also credentialed in nutrition. She has a medical degree from Columbia University, and she is a nationally best-selling author with 6 books, the most recent being the fantastic The New Normal, which I highly recommend. And on top of all of these incredible accomplishments, she is gorgeous fun, and I know her as a loving and very generous friend. Jen, thank you so much for leading us on this today.
Hi, Linda. Thanks for leading this conversation. This is a real treat.
So you have been an expert voice and influential advocate on so many health and wellness issues. Why do you think it's so important that this really great women's conference starts with self-care?
Well, I think that, first of all, it's targeted to women, but we also have to include any men that may care about the women who are listening to this conference. They have a place in this important discussion, obviously, as well. But I think that, one thing that we've all learned either personally or nationally or even globally over the last 2+ years in the pandemic is that, at the end of the day and the beginning of the day, actually, we can't rely on anyone else to help us in terms of our health if we don't take the first steps. That doesn't mean those levels of assistance shouldn't exist. They should, and they should work, but that's a whole other topic for another discussion. But I think that sense of personal responsibility for our overall health and wellness was really driven home over the last 2+ years. And I think that a lot of us saw what can happen when, that foundation is not strong. Who would have expected us to be living through 2+ years of what we've all been living through? And I think that, I really started and continue to look at this through the lens and eyes of a physician. And whether we're talking about ourselves as individuals or our collective national health and wellness, I think a lot of the principles still apply, which is that, you have to turn that lens on yourself first before you can help anyone else.
And so what are the fundamentals of self-care? And I know that you wrote this really great book that helps sort of your own journey in discovering it. And so what would you define as sort of the basic tenets of self-care?
Well, I think there are a lot of different ways to look at that, obviously. But, for some historical perspective, I think you and I are both, of the age where we remember the term self-help, right? And that was kind of very trendy 10, 20 years ago. I mean, you were probably still a teenager then, but I was, I have 10 years on you. So I definitely remember that became a whole section in bookstores, the self-help section. And I think that was kind of the 1.0 generation of this movement. Now the term self-care really is the 2.0 of that. Self-help implies there's a problem, right? We need to fix it. And self-care really, in my mind, is let's start and meet you where you are. Maybe you're doing really well. Maybe you need help. Maybe you're somewhere in the middle, but it's the care part of it, which is kind of more objective And to me sounds a little less judgmental, but to be clear, it's more than a staycation. It's more than a semi-spa day. It really starts with assessing your physical and mental well-being on a regular basis, and then providing what I think are the fundamentals to assure that at baseline, you're not just keeping your head above water, but really doing as well as you possibly can be doing.
I love that that description of calling it self-help 2.0, where it is self-care and why it's called self-care. And I also like what you're saying, that it's not something that you can like cram and do it one day, right? It's about, and I think that was one of the great takeaways from your book, is that it's consistency. It's showing up and sort of saying, okay, this is a commitment that I have, and this is what I'm going to do day after day. And really helpfully in your reporting and your advocating for this, you've talked about the trifecta of self-care. Can you explain what that is?
Well, I named it that because it has three pillars, which is, your body needs three things on a daily basis, not regular, daily. It needs rest and good rest. So that's under the sleep kind of rest category. It needs good fuel. And so I hate the 4-letter D word, diet. I like to call it fuel. I like to call it, good nutrition, food as medicine. I just think that's a more positive way to frame what we put in our bodies. So are you filling your tank with the right kind of nutrients to not just get you through a day, but to really elevate your level of health and wellness? And then your body needs to move. And how we practice our fitness routines will obviously be different for everybody, but I want to be clear, your body has to do something. When it doesn't, it will start to hurt. It's just a matter of when and how much. So for me, those things are all on par with each other. It's not that food comes first and then fitness or vice versa. They are all equally important and necessary and essential to safeguard our physical and our mental well-being. But the unfortunate thing, Linda, is that we have a very kind of reactive philosophy about health and wellness in this country, as you know. In the Western world, we would rather treat something than prevent it. And I think the onus of responsibility for that really is shared by everyone. Yes, it's, part of it comes from my profession, the medical profession, who finds it easier, unfortunately, to just write a prescription for something than to take the time to really walk someone through the steps that they need to be taking. And if they're not taking, figure out why. But the onus of responsibility is also on the lay public, or by the way, physician public. It doesn't have to be a lay person to say, that stuff is just, it sounds like so much work. Wouldn't it just be easier if you could just write a prescription? And the answer to that is, yeah, it would be easier, but that is not actually, in my medical opinion, the best way to go about it. So those three things, the trifecta, I feel are so important that when I see an actual patient in my medical practice, if they have any issues, that is where I start. And until those things are on lock, I am pretty reluctant to then start going to the prescriptions or the fancy tests, because that is how important they are.
Eating well, sleeping, and moving your body. And there's a lot more once you get, so that's sort of like for you, where you call it the trifecta, like that's the baseline for what you're saying of people need. And then there's additional things that you've been recommending in your books and on ABC of you've talked a lot about meditating and how that's been beneficial to you. And that's really been something that you've adopted as a form of self-care. Can you talk to us a little bit about that?
Yeah. Have you ever tried meditating?
I have my mantra, but I'm not consistent about doing it.
That's okay. I mean, I can't believe you and I haven't talked about that yet, but I also have a mantra, and I am also less consistent than I would like. However, it dovetails into why and how it's so important to integrate our mental health and our physical health. You can't have a healthy body without a healthy mind and spirit, and vice versa. So, they go hand in hand. Unfortunately, I think, again, in Western culture, we tend to, draw a line, like a dotted line from the neck up, and then, we're better at looking at the body from the neck down. But in terms of meditation, it was an interesting kind of personal revelation for me, because I think it's almost 10 years, maybe it's 8 years or so now that I first learned. I practice transcendental meditation, but there's so many kinds of mindfulness, and it's just about finding what you like, and what works on your day-to-day schedule and routine. But at the time where I was introduced to TM and meditation, I was guilty of exactly the kind of thing that we're talking about now, which is, I was only focused on my physical well-being. And so I was making sure that I was doing cardio and lifting weights and watching what I ate and getting enough sleep, 7 to 8 hours every single night, despite my insane work schedule and 4 to 5 a.m. wake-up calls. And I was so smug about that. I thought, like, this is so great. I finally found the way to do it myself and not just talk about it. And then I realized that the 800-pound gorilla in the room was that I was not addressing anything in terms of my mental wellness. And so I had met a couple of people that swore by meditation. And finally, it was just like, the pecking little bird on my shoulder. And I said, okay, this is the sign. I have to learn. And I learned. I tried it for 2 weeks, and my kids, because as you and I know as moms, when your kids hold up a mirror to you, that sometimes is all you need to hear, right? I mean, my kids will often tell me, can you get off your phone? And when your kids tell you to get off your phone, not only is it embarrassing, but it tends to be quite impactful. But after that 2 weeks, my kids saw a difference in me. And I said, what do you notice? And they said, well, you're just, kind of more relaxed, less stressed. And I said, was I stressed before? I didn't know. And so I think that, if I could write a prescription for meditation for our mental health and well-being, I would. That is how powerful I think it is. And I will tell you, I don't know why I'm inconsistent with it, because when I meditate 20 minutes, 15 minutes, guaranteed, not most of the time, not some of the time, guaranteed, I will be in a more positive mood. I will be mentally more efficient, sharper, more energetic. It gives me a feeling that I've added time to my day. And I think everyone should do it. That's how powerful I think it is.
It's a great endorsement. And I think that one of the reasons why it's one of the ones to be tougher to be consistent with is because you physically feel the results of moving and the results of sleeping. And to be honest, by the time, if you have a schedule like yours, by the time you drink all the water you're supposed to drink, you meditate, you exercise, you practice yoga, you practice your gratitude, you sleep 8 hours, you stretch, that's a day.
That's right. Yeah, you're right. It is so hard, but I would actually argue, especially for women, with all of the multitasking that we do, which I actually believe we're evolutionarily programmed to multitask. And there is some science that backs that up, that if we do these things, we will actually be more efficient. And that is the holy grail, right? For any woman or man, but certainly for any woman, to be more efficient. Who wouldn't want that? And I really do believe that if we do all these things, we'll be so much better at everything that it ultimately and eventually will be easier to do those things.
I think that's great. And so just to clarify, I was sort of joking about all of the elements that go into really great, what we know to be really great self-care. Is it selfish?
I think it's the antithesis of selfish, actually. I think that for most women, we feel like it's selfish if we say, actually, I have to decline, or actually, I can't do that. I have to take this time for myself. As I say in one of my books, no one will die if dirty laundry gets left in the hamper or a dish gets left in the sink, before we go to sleep. That is, you can't say that about everything, but you can say it about those things. So we have to put ourselves first. But the real reason for that, and this is non-judgmental, it's not bad, it's not good, this is the reality, is that because of how our minds are programmed with all of the other roles that we balance in our lives, with our family, with our friends, with our partners, with our jobs, with our communities, if we don't practice self-care, we will not be good at those things. And if we really care so much about all those things and roles and responsibilities, which we do, the best way to execute them at a high level is to practice self-care. For me, that is an incredibly real kind of, I'm confronted with it on a daily basis. If I do not get adequate sleep, I can't speak well. And millions of people listen to me on Good Morning America and watch me every day for the latest on COVID, or, discussing the latest study. And the stakes are too high, for me to make a mistake if I'm saying the wrong thing. And, that's what happens if I don't get enough sleep. And when I see patients, they're seeing me once a year. They don't want the tired and forgetful Dr. Jennifer Ashton. That's how I look at it. I think it's the opposite of selfish.
So it's a way, and again, it's the consistency, it's the investment in order to show up, bring your best self, to take care of your family, to show up for your job and for all of your responsibilities. And that ties into this idea of overall, you cannot put, especially women, put their health needs last. You're actually not helping. The martyr thing isn't helping anyone.
No, it's not. And, we now have some data on what's happened to women in particular during the last 2 years of the pandemic. And just as we've learned that certain races and ethnic groups, certain parts of the country have been disproportionately affected by this pandemic, so too have women with disproportionately increased risk in many mental issues like anxiety, depression. Men have increased rates of that also, but not as high as women. Women, of course, making the brunt of their decisions for their household in a situation of significant economic uncertainty. And then when you look at women all over the world with how this pandemic has affected them, we need to care about that. We typically take an insular view in this country of, what's going on here? What do I have to worry about? What's going on with women in the United States? Make no mistake, what is happening to women and girls in Africa and other parts of the world where they have been literally amputated from leaving their homes to go to school, and all of the domino effects that this pandemic has brought on that go along with that, an increase in sexual violence, an increase in maternal mortality, which was already in a bad way before the pandemic because reproductive health services were interrupted or completely disappeared. That affects us. That affects us on many levels. So I think that, you have to look at this differently. Yes, it's something that has affected everyone, but its effects on women and girls really need a specialized and targeted approach.
And so what are some of the latest information that we have on some of the big women's health issues? Is there anything the pandemic, as you're talking about, sort of really brought to light mental health. Yeah. Is there anything within mental health or other areas that you think that we should be talking about?
Well, I think that the one thing that I always say, I'll retire from medicine when I feel satisfied that women everywhere know this. And sadly, for both my prospects for retiring and more importantly for women, it's still something that women say, oh, I didn't know that. And it's just an example of how access to information doesn't always equate to using that information in a way that helps you move the needle. But heart disease and its link to reproductive women's health issues has been really on the medical horizon for the last 5 to 8 years. So what do I mean by that? I mean, there are a list of very common OBGYN conditions that affect anywhere from 8 to 25% of women that are now considered in the world of cardiology and heart disease a risk factor, a failed stress test for heart disease. You know, this is about one hand talking to the other. So I'm talking about things like polycystic ovarian syndrome, gestational diabetes or diabetes during pregnancy, having a preterm delivery, having problems with the placenta or a fetus or a baby that's small for the stage in pregnancy that a woman delivers. Those are almost, you can think of them almost the same way as high blood pressure, high cholesterol, smoking, obesity. We know now that those increase a woman's risk for heart disease later in life. So I've been trying to raise attention to OBGYNs to talk to cardiology colleagues, which in my family should be easy because my father is a cardiologist. And we have some very boring dinner table conversation when we get together and he'll say, oh, I didn't know that. And I'll go, oh, if you don't know it, Dad, we're in trouble. But this is something that any woman or man who's listening to our conversation right now can say, talk to your gynecologist at your next well woman checkup and say, do I have PCOS or did I have diabetes in pregnancy? And what do I need to know about how to use that information to lower my risk for heart disease? Because Linda, if we had another woman in this conversation with us, one of us will die of heart disease. And guess what? No one thinks it's them, right? You and I are probably saying, well, that's not going to be me. But that is the number one cause of death for men and women in the country and in the world. And so I love the concept of one specialty getting on board with another, but this is truly, in my opinion, the definition of holistic care, right? It's not about treating a body part, it's about treating the whole person. And more women need to know about this, more cardiologists need to know about it so that our daughters and us cannot become a statistic.
And this is all part of prioritizing your care of, nutrition, sleep, exercise, like that. That's sort of the basics. But then this is all looking after your overall women's health issues is such an important part of that as well. What is something that women today, and actually I do want to pause on one thing, and I think that you've been very good about talking about this. Where we say that women are not practicing self-care and putting their own health needs last. And I've heard you talk about how this is something that men do as well. Women sort of, and you could sort of go over the numbers and whatnot, but it's not a gendered issue. It's more of a society issue where there is so much emphasis on sort of what you can outwardly see in terms of output and performance that self-care gets neglected on men. So how do we help the men in our lives?
Well, I mean, I'm glad you mentioned it in that way because like any issue that tends to be described as a male issue or a female issue, it's really a human being issue, right? Because as I like to say when I talk about women's health topics on the air, that's not just talking to an audience who happens to have ovaries. Many men know at least one woman that they care about. I would bet it's every man, right? Has a sister, a mother, an aunt, a wife, a daughter, a cousin, a friend, someone, right? So I think it is important. as much as we like to and need to look individually at certain vulnerable groups and target and personalize our approaches, there are some things that really do cut across all those lines, and self-care is a big one. And look, there are sweeping generalizations that we make and often joke about, in an effort to bring some levity into a conversation that, look, we do as women, as moms, tend to put ourselves last. But men, if you want to generalize, tend to be very stubborn. And so, okay, we're both guilty, and now we need to just move forward and do something about it. And I think, the best way is to really, this is something that for some people is scary, for some people is logistically difficult, for some people, they feel intimidated or judged or embarrassed or any of those things. As that joke goes, ain't nobody got time for that. We just have to move on and, and ask someone to be your accountability partner, whoever that is, and say, look, I've been putting this off. I really need help, but I want to go and do A, B, or C. Will you help me? And if I go, maybe we could do it together. And I think that we just need to cut away any procrastination or excuses or misconceptions, because we've learned in the last 2 years that we have to be prepared for anything. And that means we have to prioritize our health and well-being.
I think what you brought up is a really great point. I've heard you talk about it, and I've seen you write about it as well, is this idea of the accountability aspect and sort of making the self-care a group project. And so that's why sort of if you have a brother, a son, whatever it is in your life that's a male, that's bring them along as part of this journey, in addition to bring women as sort of making it a thing, normalizing self-care, normalizing getting proper sleep in your household, and normalize, eating well and moving your body, sort of all of these things, making it a group initiative with that accountability helps. It's contagious in a way.
Yeah, I mean, think about all of the other things that peer pressure, is hard at work. And oftentimes we talk about peer pressure as connected to something that's negative. It could be positive, and if we all kind of made a pact to do that with our selected accountability partners, not only do I think our health would benefit, but also we're teaching our children and the people who really are looking at us, maybe through like a side glance, a side eye, I want to see what so-and-so is doing. I want to follow your lead. And we're setting a powerful example of a way to elevate our wellness. You talked as one of the things is a fuel. I want to talk, I know nutrition is such a deep subject, and you have such a level of expertise in it. And you've talked about the 4 S's of nutrition, and you're just such a great communicator that you give us all of these things that we can remember and take away. So can you talk to us about that? I hope I remember the 4, but always say, I'll start with the first 3, which are, let me give you some background on that. When I went back to my alma mater to get my master's in nutrition, I did so because I would see it on television, which is half my career, and as well in a real practice, how nutritionists and dietitians who know a ton about food would oftentimes be talking about disease states and wellness, and they don't have an MD after their name. They have not learned the same things. There is a little bit of overlap, but not even close to enough. Similarly, doctors would be talking about diet and weight, and I knew for a fact that we learned 0 nutrition in medical school. So I said, this is just not the way that, things should be. So I went back 3 years to get a master's in nutrition. And I was initially a little disappointed because I realized that the level of nutritional science is not where the level of medical science is in terms of research and the rigor of the methodology behind a lot of studies. That doesn't stop the studies from coming out though, right? So when these studies come out, latest diet, lose this, lose that. You see it on TV, you see it in a magazine, you read a book about it. I want to be clear. Any diet can work short term. And short term could be a month, it could be a week, or it could be a year. The key is, and this goes to the 3 S's, is it sustainable, lifelong, and the 2-year mark is what the studies look at. Is it safe, right? Because there's plenty of unsafe diets out there. Things need to be safe. You don't want to trade one problem for another. And is it simple? So what was my 4th S? Safe, simple, and sustainable. Sexy? No, it doesn't. And I think that, and I think it has to work for you. There's no such thing as the miraculous. You and I try to eat pretty vegan most of the time with fish, but that works for us. For other people, paleo or Mediterranean or keto-ish might work. It just has to work for you. So 3 S's are my recommendation. If you remember what my 4th S is, let me know.
I'll be able to tell you in a few minutes. I can't remember off the top of my head, but it was just but the idea of it, again, you just have these really great messages of consistency and bringing this to your self-care of showing up. And it's, again, you're not going to do it in a week. You're not going to do it in a day. But if you're consistent in finding this plan, and you and I are mostly plant-based. And when you talk about, when you advise people on developing a way of eating, a fuel philosophy, you've talked about doing it gradually. Like, you don't have to start out and go from being an omnivore to being plant-based in a day. You can start by eliminating, which is what I had done. I had slowly eliminated each animal until I was there, and it was it was less of a shock, and it was a more sustainable way of doing it.
Yeah, I think that's really important. And also be curious and do an experiment in yourself. You're not tied to anything. You could always go back, but see how you feel, because at the end of the day, it really doesn't matter whether 80% of people achieve this. It matters what happens to you. So just look at it in a geeky scientific way, like I look at almost anything, and sometimes it'll be easier to do.
You also talk about which is really wonderful, is that you've really been normalized and made a lot of conversations okay and accessible. And you've talked about ways that you protect your mental health. We already talked about meditation and exercise, and those are 2 things that I think are really fundamental. What are some additional things that you would advise the women here to also do to protect their mental health?
I mean, I think that's a good way to kind of leave this conversation, although you and I could talk literally for hours. But, I did learn after the suicide death of my ex-husband and my children's father, and he was a physician and didn't have any of the overt signs of depression that we learn about in medical school. But of course, in looking back, as I blamed myself and asked, what did I miss? There were things that I think, in retrospect, were signs that he was struggling. So one of the other things that I do, and my children who are 22 and 23 do, is, we, first of all, have prioritized our mental wellness. And in exactly the same way as we would go to the dentist, who likes going to the dentist, right? I mean, maybe some people, but I'm not one of them. We check in with a therapist regularly, not just when we're struggling. And even though sometimes that seems unnecessary, we've signed up for that for the rest of our lives because of personal experience. But when you realize how many people struggle with anxiety and depression and have been affected by suicide, which is millions and millions of people, the importance of doing that, the checkup from the neck up, is really something that I think we all have to recognize. So asking for professional help, even though the access to that can be difficult for so many people, in some ways, again, with telemedicine and apps, it's kind of more accessible than it ever has been. It needs to be even better. But then I think the other thing that I do is recognize, acknowledge, and normalize when I'm not feeling great mentally, or, when I'm feeling stressed, when I'm feeling anxious. Not just keep your foot on the gas and keep going, but, I think what I've said to my patients, and now I say it to myself, is if I had high blood pressure, I would pay attention to it, and you would treat it. And so if you struggle with anxiety or depression or anything in the neck up realm, normalize it and ask for help. There is no shame in that. In fact, there's strength in that. And the last thing I would say is, we can do that with each other as well. And when we ask, how's someone doing, really stop and pump the brakes and wait for them to answer. Not just, hey, how you doing? Okay, next. But really, because that matters. So that's what I do. I'm certainly, still learning with that every single day, but I think, we can't improve something unless we at least acknowledge that it's there. And so mental health has become a priority to me and my family.
Dr. Jen, this has been a fantastic conversation. If you're interested in more about what she shared about recovering and handling, her book, Life After Suicide, is a really touching and an important read if you're doing with that. Her book, The New Normal, is her latest book, and it's about how are we adjusting, and it's really teaching you to think like a doctor in how to approach this new normal and not just look backwards. And her work on self-care was really well documented in this really fun read, where you learn that it really is self-care is something that it is important to prioritize. And we're really grateful for this summit for bringing it to light, but it is something that you can do. You have to do consistently. And there are incremental steps that you can do to really improve your health and wellness in order to be a better person for everyone around you. So thank you, Dr. Jen, for sharing this message and encouraging all of us to do better in prioritizing our own care.
Thank you, Linda. I could talk to you for hours, and thank you guys all for watching this, and to the 92nd Street Y for doing this summit. It is more necessary now than ever.
Welcome to our caregiving presentation, in which we'll be talking about caring for yourselves as you cope with the stresses of caring for others. My name is Dr. Penny Stern, and I am the Chief Preventive and Lifestyle Medicine at Northwell Health. I'll be serving as your moderator. Our expert panelists are Dr. Jill Sonnenklar, Senior Psychologist within the Northwell Health System. Her role in the Division of Developmental and Behavioral Pediatrics includes providing individual, family, and group therapy to children, adolescents, and adults. And Dr. Donna Seminara, a board-certified internist and geriatrician with over 25 years experience in private practice. She is the Director of Geriatrics at Staten Island University Hospital at Northwell Health and Medical Director of the Egger Healthcare and Rehabilitation Center. Thank you both so much for being here today. So many of us are trying to juggle a multitude of duties, including work responsibilities, family life, the needs of children, parents, spouses, partners, friends. Caregiving can be a challenge. So I'd like to start by asking you, Dr. Seminara, what do people need to think about as they approach the role of caregiver?
I do think that it's very important, as we accept the role of caregiver, to recognize all of the external pressures that we have. Certainly, you're providing care for a person, you're providing care for your own family, and you may have other obligations for those in generations above and behind you. In order to keep yourself in the best shape possible, it's really important to prioritize your own health so that while you're in the midst of providing care for others, you're not worried about your own care. So number one, it's so important to have a good relationship with a primary care physician with whom you can reach out and contact should you develop trouble. The important thing while you're the sandwich generation is to make sure that you yourself are being protected from things that can interfere with your ability to provide care. This can start with healthcare assessments for cancer screenings. Women should be getting pap smears as indicated by their gynecologist and based on their own gynecologic history. Mammograms are absolutely in order, and for most of caregiving age, this may be being done on an annualized basis. Indications for colonoscopy have recently changed so that colonoscopy screenings now actually start at the age of 45. Some women may be predisposed to early onset bone loss and may require DEXA scans before menopause, although most will require them afterwards. And it's very important at this time to do an honest assessment for your own cardiovascular risk. Unfortunately for women, sometimes the preeminent presenting symptom is sudden death. So if you have underlying cardiovascular risk with high cholesterol or hypertension, being overweight or a diabetic, it's time to start to manage those risk factors now and perhaps get yourself screened for a good cardiovascular assessment. Another system that we don't always think about is that of oral care. When you're under stress, underlying pathologies with gingivitis may flare and be very disruptive in your ability to provide care. So that's an important screening assessment that I think we often forget about. Now there are the other social factors related to health. What is your weight at and how should that be optimized? Are you an exerciser or not? If you're a smoker, have you done the appropriate cancer screens for smoking with a CAT scan of the chest and sometimes an analysis even for bladder cancer? Of course, stopping smoking would be the best thing of all. Recognizing that that's difficult, any amount that you can decrease will benefit you. And you certainly don't want to be exposing the person for whom you're providing care with secondary smoke. Alcohol should be limited. And of course, recreational drugs should be completely avoided. These are some of the basics, but if we don't address them for ourselves, it can be very difficult if they flare emergently when we're providing care for others who are dependent upon us.
That was great. I'm a preventive medicine specialist, and I absolutely agree with the centrality of screenings as part of health maintenance. And we're living, especially now, in unusual times, more than 2 years into this pandemic. So what's your advice, Dr. Seminara, as to how, as caregivers, to avoid bringing infectious disease into the home, how to protect those you're caring for during pandemic and also in general?
Well, this is a very hot topic, as you can imagine. And as an administrator for a home visit program, it was particularly tragic for me to see homebound patients develop COVID. The only way that they got it is that their caregivers and their home health aides brought it into them. And that's a very tragic situation. So without looking to spend the hours on COVID that we could, we certainly are all aware now of the 2 messenger RNA viral vaccines that are available with Pfizer and with Moderna, separating the primary immunizations by either 3 or 4 weeks. Also, there's been a lot of publicity about the need for subsequent boosters. A first booster being done after you've hit about the 5-month mark now after having had a primary immunization. Secondary boosters are also being offered, and I think the indications for the why and the when should be individualized for the patient. We have so many people in our own clinics now who've had COVID recently in between getting primary vaccines and secondary boosters. So there are a lot of factors that may go into the timing of this, but there's no doubt that immunizing the patient at home is essential, as well as all of the caregivers who come in contact with the patient. One cannot assume that just because somebody is being hired through an agency, that they have been appropriately treated with vaccines before coming into the house. So that's an important question to ask when you're working with a home care agency. Now, all of the other immunization schedules are also important. So for instance, annual flu vaccines are very important. We know that influenza can still occur even if vaccinated, but in general, as with COVID, the side effects are usually less intense. Hospitalizations and deaths can be avoided by being appropriately immunized. Furthermore, for pneumococcal infections, this is a bacteria from strep pneumonia. This can be a very devastating infection, not only for immunocompromised persons, but for healthy persons as well. And the indications for immunization here have also very recently changed so that we now have Prevnar 20, which is a pneumococcal 20-valent conjugate vaccine, which can be given once after the age of 65, and then that would be it for needed coverage. There are, however, other options using a Prevnar 15 followed a year after by pneumococcal vaccine, Pneumovax 23. The appropriate choice really should be made based upon the individual's previous immunization history, and again, conversing with the PCP for yourself and for the person you're caring for can help point you in the right direction. One thing that COVID did, I find, particularly for my older patients, is that it made them much more aware of the availability of these vaccines and also vaccines for shingles. I've never seen so much interest as I have now in the shingles vaccine. And we now have Shingrix, which is a 2-step vaccine, each administration given within 6 months of each other. And that can be purchased at pharmacy and is available for whom it may be appropriate. Another vaccine to keep in mind for caregivers who are grandparents and caring for young grandchildren is the Tdap, where they can get coverage for tetanus and pertussis. And pediatricians are very good at telling young parents about the need to get the grandparents immunized for this. So immunization is very important. And the most important other thing is good hygiene. You've got to wash your hands frequently when you're caring for a person who's got multiple comorbidities or who is immunocompromised. Wearing a mask so that you're not sharing germs, using gloves, especially when you're dealing with cleaning patients who may be soiled, when you're handling soiled materials, is very important to limit contact to yourself. And I do have several families, and I have done this myself when caring for those who are elderly in my family. If I'm going to visit them and I've been out in the office or the hospital, I completely change when I get to the house. I shower, I wear a mask and gloves because I don't want to contaminate them and bring them anything that I may have been exposed to. I don't want to be a passive carrier. So these are different extremes of what is needed and necessary, but a good conversation with your own doctor and then also with the PCP for the person you're caring for will give you good individualized guidance on which of these recommendations would be most important for you to follow.
That was great. Just one more thing. Can you tell us more about making the environment safe for those we care for as well as for ourselves?
I never learned so much about the environment of care until I started to do home visits myself. And I frequently saw where things broke down when I went into the home and learned about the home environment. One of the most important things really to see is, where does the patient sleep? Does the patient sleep in a regular bed, and is that bed appropriate for them? If they bought a California King 10 years ago, it just may be too high for them to be able to get off of safely now. So sometimes mattress heights need to be adjusted. For many patients, however, who have multiple comorbid illnesses, it's really best that they have a hospital bed. There are hospital beds that have cranks to elevate and to lower different parts of the bed. An electronic bed is, of course, the easiest because you can easily raise the head of the bed, raise the legs of the bed, and this is very helpful. Having side rails at the top of the bed allows the patient to be able to rotate appropriately so that if they need to be rotated so that care can be given to their back, using side rails as a lever is very helpful and important. And for patients who are primarily bedbound, they should have a specialized mattress to avoid complications of pressure injury. If you have someone who you're caring for who already has a pressure injury or an ulcer, it is absolutely imperative that they are on a mattress that helps to alleviate that pressure. There are egg crate mattresses, airflow mattresses, and these are very readily available and ordered easily by a physician prescription. It's important to learn how to rotate the patients in bed to decrease the risk of pressure injury. So knowing the type of bed that the patient is on is important. Seeing that it's appropriate for their level of function is vital. And also, even if you see a bed, ask if that's where the patient actually sleeps. I'm amazed how many people actually sleep in recliner chairs. They sit in them during the day and they live in them at night. Some of them are excellent. They really allow for significant change in body position for the patient so that they can be fully recumbent and even have their legs elevated while in the recliner. The recliners come in sort of fashionable cloths and artificial leathers so that they can be positioned in a family room so the patient is socialized with the family, which I think is so important. And they are generally very comfortable. Also, for particular disease processes, you can get electronic chairs that will actually take a person from recumbency and get them fully upright. So for Parkinson's patients, this can be particularly helpful. Using bolsters in bed can help to elevate legs if they have edema problems, can help to enhance breathing by elevating the head of the bed or the recliner. So it's important to see how the patient uses the equipment that they sleep in and be sure that they're using it appropriately. Another area that's very important in the environment of care is decreasing the risk for falling. The number one room is the bathroom. Patients go in, and a very typical scenario is they'll turn on the hot water to get ready for a shower and then go sit on the toilet. And while sitting on the toilet, they may drop their blood pressure if they're straining to defecate, or sometimes even the process of urination can drop a blood pressure. And they stand up, and the room is starting to get foggy with mist. The walls are getting wet. The floor tile is wet. It's a very dangerous situation. And I'm sure if you all think about it, you know someone, and maybe it's you, who reaches over the side of a tub to hold onto the soap bar, the soap dish, and uses that to balance yourself stepping over into a tub to a shower. Stepping over the tub is a primary way that frail elderly persons will fall. If one has the economic means, the safest thing to do is to put in a walk-in shower. Walk-in showers are very easy. You can actually bring a wheelchair right into the shower. You can transfer a person right onto a very inexpensive plastic chair so that they can have some control in the showering process, also with a handheld shower head. This is so important. Having grab bars up, very important. And almost all contractors are now used to converting bathrooms in this manner. So it can still look non-institutional, so to speak, and be functionally very appropriate and safe for a person who's going to be using the space. Other things in the environment, enhanced lighting, making sure that the ambient temperature is appropriate. These are all, very important aspects of the home environment. And when I'm in the house, I also look at the durable medical equipment that's being sometimes used and sometimes stored in the house. I'll see wheelchairs in the corner with cobwebs on them. I'll see lots of canes and lots of walkers sort of piled up. And when you ask the patient how they get around, they may not be using any of it. And they just walk from furniture piece to furniture piece. There may be too much clutter. Clutter is a big problem in terms of risks to fall. Sometimes I've walked into homes where there's overt hoarding, and the hoarding, aside from its own pathology, certainly provides a lot of health risks for patients based on how orderly. I've been to very orderly hoarder homes, and I've been into some very unfortunate environments where there are very obvious infectious risks as well. Seeing all of that can cue me into other social challenges of the patient. Sometimes I have a better insight into the actual poverty of a patient when I'm in their home. Sometimes I'll ask for a water and they'll open the refrigerator door and I get to eyeball, is there food in there? what types of things are in the refrigerator. And I can make offers for food supplementation with Meals on Wheels programs, for instance. So doing a home visit has really opened up for me the tremendous value that can be gotten by seeing where and how a patient lives. And when you go to care for someone in your family, could be someone who you haven't been in their home for quite a while. And it can be sometimes alarming and upsetting. But with that insight, the important thing is not to challenge the patient, but help them to manage and make their environment more healthy for them. And it's a process. You can't change things very quickly. I've gone into houses, moved the kitchen chairs to make it more spacious, appropriate, and then I go back and everything's, back the way they really want it. So you have to take your time with it, but there's a lot to be learned by visiting patients in their home.
And that was great. So many external environmental aspects to consider. Dr. Sonnenklar, can you give us some guidance as to the internal coping skills that we can sharpen? We've talked about the external environmental aspects. What are some of your favorite coping skills and why?
Sure. First of all, those were some wonderful suggestions just to keep our environment around us safe, very, very important. But it's also important to make sure that we're feeling okay on the inside as well. And there's lots of good coping skills out there and lots of good skills that can help us calm down, get through difficult moments. People have their favorites. What I tend to do when working with people is I tend to throw out a lot of them, and some will stick and some won't, and that's fine. People find their favorites. I personally love deep breathing. There's lots of different ways to do it, but it's important that you do it low from your belly and slow. And that's a quick and easy way to just kind of catch your breath literally and calm down. There's many different relaxation techniques. There's visualization where you basically imagine your favorite place and use all your senses to kind of conjure it up. So for me, it's always the beach, and I'm imagining what I see, what I smell, and like maybe what I am touching, like the sand underneath my hands. And you use all the senses and just kind of conjure up that image and just give yourself a little bit of a break, even for 30 seconds, just by transporting yourself to that place. There's self-statements. Those are things that you can say to yourself, and everyone will find their favorite. Something like, I can do this, I'll get through it, I can handle it. There's things like distraction, and we use this all the time. And we all use our phones for distraction. I mean, think about when you're waiting online for anything, everyone's always on their phone. And that's a way to kind of distract ourselves to get through the moment. And that's fine. There are things like self-soothing, just taking care of yourself. And often those involve your senses as well. It might be drinking a nice hot cup of tea. It might be something like petting your cat. Again, using your kind of senses to soothe yourself. And there's also mindfulness. There's a lot of research about the effectiveness of mindfulness. It's been shown to decrease anxiety and decrease depression, help people be more focused, be more present. I can go through a whole slew of different mindfulness exercises, but they're all out there on the internet, so you could find your own favorite. And you asked, why are these my favorite? I would say because these are exercises, these are things that you can do anywhere and no one will know. And that's so important because you need to use these tools whenever you can, whenever you need them. They will work, but I will say one thing is that they work when you practice, when you know what you're doing. So some people expect, okay, you've taught me all these skills, and then they're in an anxious moment. All of a sudden they're like, but I'm trying to visualize and it's not working. No, it doesn't work that way. You have to practice visualizing during a calm moment so you're able to do it. And then when you're in the stressful situation, it will work. So practice is important.
Oh, that's great. So what do you say to the person who will tell you, I know relaxation is helpful, but when I have to work deadlines and I have kids to take care of and everything else, I don't have the time. What can I do? What do you say to them?
Yeah, no, it's so hard to find the time. Everyone feels that way. You feel like you're doing so many things at once, but you could find the time and it's important to do it. And there are some very quick relaxation tools. One that I love doing myself and teaching my patients to do is something called squeezing lemons. And that's just where, you just imagine there's lemons in your hands and you're squeezing and squeezing, and you imagine like the juice dripping and you imagine the smell, and you squeeze for like 5 seconds and then you drop it. and your hands feel all light and tingly. And that's a relaxation technique. If you're standing there like this, people are going to notice it. But if you're putting your hands on your lap and doing it, no one's going to notice. So that's something quick that you could find time to do. But I think the important thing is to fit these techniques in whenever you can. Deep breathing you can do whenever you can. Yes, clearly with the kids that I work with and adolescents, when they're going into a stressful test, take the first 3 seconds and just deep breathe. It really makes a difference. When they encounter a question that they're not sure what the answer is, take a second and deep breathe. When your boss calls you into the office, take a second, deep breathe. And I also tell people to do that whenever they can. Like if they're at a red light, breathe. That's a good time for you to breathe. Recently, I've noticed myself when I'm in the kitchen and I'm heating up my coffee and I put it in the microwave for 30 seconds. I notice that I say to myself, okay, my coffee is going to be in there for 30 seconds. What can I do? Can I wash some dishes? Can I cut some vegetables? And now I'm saying to myself, you know what? It's 30 seconds. I'm going to take those 30 seconds and just be and just breathe and just relax. And so there are times like that if you work it into your day, you can find the time to just use some of these techniques.
Oh, that's incredibly helpful. I appreciate those tips. Dr. Seminara, when the caregiving is for an older person who has certain limitations, shall I say, how can a caregiver handle the frustration that comes with elder care as opposed to with younger folks?
Sure. So I think one of the most important things that caregivers need to learn, and it's a process, is that there's a difference in caring for everyone else versus those who are most senior, okay? They really are dealing more with geriatric syndromes, and those syndromes affect their health and their function to a much greater degree than the diagnoses that they've been carrying for decades. So it's less important to a person who's 85 plus, let's say, what their LDL, bad cholesterol is versus are they sleeping? Are they able to have regular bowel movements? What matters to them? In fact, an age-friendly health system is really oriented around the 4 M's. And the 4 M's are what matters most, mentation, medications, and mobility. So very quickly, for medications, polypharmacy is a very big risk for older persons. Each time they go into a hospital and they see specialists, medications get added, or they're added to long lists of medications that the patient has already been taking, often for decades. It's funny, but as a geriatrician, I sort of go in and start deprescribing. I take away and try to see what is absolutely necessary. As patients age, their body weight may change. Their percentage of body fat to muscle certainly changes, and that may change also their need their need for and the amount of medications that they take. So that's a very important thing to understand. Mobility. Is the patient mobile? Can their mobility be improved? Are they using their durable medical equipment, the wheelchairs and the walkers, appropriately? As I had mentioned earlier, the patients with multiple canes and walkers in the house, they often go out with the simplest thing, which is a cane, which actually may be the most dangerous for them because it doesn't really give them the stability that a squared walker would. So one needs to really be very careful about that. Mentation really focuses on the 3 Ds of geriatrics, which is dementia, delirium, and depression. The majority of the people who consult me directly are dealing with exacerbations of these 3 problems. And they are very significant because when patients become very behaviorally disruptive because of any of these things, it disrupts the family that's providing care for them, and it puts the patient at risk for institutionalization. It's very important as the caregiver to be appropriately observant and to describe to the PCP or geriatrician of the patient very specific examples of what you see as behavioral decline. Become a good reporter, because it's not your job to make the diagnosis, but the more clear information you can give to the geriatrician, neurologist, or internist, the more likely it is that the appropriate diagnosis will be made. And this is very important because all of the medications used to treat dementia, delirium, depression can have their own adverse side effects. So it's super important to get that down correctly. And then what matters most, if you ask the patient, they will bring up the issues that they can't sleep, that their bowel movements aren't regular, that they're frustrated by sensory impairments. And you've got to give time and attention as the doctor to those factors. Often the issues of sleep are a primary issue for the family and for the caregivers as well. And if you have an appropriate diagnosis vis-a-vis dementia, delirium, and depression, you can probably choose the best medication regimen to address the patient's insomnia. But again, it all comes down to having very good observational data from the caregiver to make the appropriate diagnosis.
Wow. So Dr. Sonnenklar, after we heard all this about elder care, what about the frustrations associated with childcare, like wishing children could be more independent, do more things on their own? What can you tell us about that?
Sure. No, it could be very frustrating. And obviously, the frustrations change according to your child's age. I think it's important that you ask yourself, what are your expectations? And that can keep your frustrations in check. Is what you're expecting age appropriate? Can your child do what it is that you're asking them to do? And there's a difference between can'ts and won'ts. So, for example, if you're asking your child to make their bed, a 10-year-old can make a bed. And if they're not doing it, they're probably being willfully defiant, or they might be willfully defiant. But if you're asking you have the same request for a 3-year-old and they're not making their bed, it's a little bit of a different story. They don't have the skills. They don't know how to do it. So that's a difference between a can't, something a child cannot do, versus a won't, something a child will not do. And if you recognize that some of these things that we're asking our children to do are actually can'ts, and if you recognize that, it might change the way you feel about the behavior or about your child. I can tell you, I often get parents that say to me, I want my child to sit through the family movie night. That's a 3-hour movie that you want your ADHD child to sit through when the child is 5. That's a can't in my mind. It's not that the child's being willfully defiant. The child physically, neurologically cannot do that. So, and sometimes for can'ts, the child doesn't have the skill, and we have to learn this, and we have to teach the children the skill. So maybe making the bed, teach your child how to actually make the bed. It might be, doing homework independently. Your child might not have that skill. Break it up for them, give them steps, coach them, teach them how to work independently. Don't just expect that they're going to know how to do it. We might have as children, but it's not necessarily the case that our children automatically know how to do these things. I often recommend making a list for parents to make a list of things that the child cannot do versus things that the child will not do. And when I give this assignment, I say very clearly, I want one spouse to do it and the other spouse to do it, each one to do it separately. If you want to get grandma involved or the babysitter involved, fine, but each person make up their own list. And it's always amazing to me how the same behavior, one parent can view it as a can't, and the other parent can view it as a won't. And we got to work on that and come to some sort of resolution about how to view the behavior and what to do about it. So I think that when you find yourself being frustrated, ask yourself if the child can do what you're asking them to do. And obviously, if you are getting really frustrated, use some of those coping skills I just talked about before, and just to get yourself through the moment. Take a deep breath. Sometimes I always ask parents, what kind of skills they do use. In every group, I run this ADHD family group. In every group, I always get a parent raise their hand, and she says, usually it's a shake, white wine works wonders. And I think that we know that's not where we want to go. We want to develop more effective coping skills. But so find what skills can use. And actually, one thing that parents often say is that they find themselves yelling out of frustration. And we know that yelling isn't really effective. It just obviously increases, bad feelings within the environment, within the home. But when you're yelling at a child, I can guarantee you that the child has tuned out. They're no longer listening to the words. What they're focusing on is, gee, your face gets really red. And do you know that there's spittle that comes out of your mouth? And like, it's almost like steam. And that's what they're focusing on. So they're not listening to you. So I would recommend, when you do get frustrated, try some of these coping skills, try changing the way you think about it, and try to keep the emotional intensity low. That way you're going to be more effective.
So how will recognizing that it's something that a child can't do versus the won't do, how will that change the way the caregiver feels?
Yeah. Great question. I'm going to use this opportunity to give you the cognitive behavioral therapy, the CBT in a nutshell. Basically, CBT is this triangle for how thoughts, feelings, and behaviors are all interrelated. So if you change one, you can change the other. And it doesn't make sense initially, but once you think about it, it makes perfect sense. Let me give you the example about a kid that's acting out in school. Let's say we have Johnny. He's in his classroom. He's always loud and he's always interrupting the teacher and he's always tapping the kids on the shoulder and then trying to talk to them. And he gets out of his seat and he walks around and sometimes he makes paper airplanes and throws them. So Johnny is clearly disruptive. And if the teacher thinks of Johnny of him being obnoxious, defiant, rude, whatever, most likely that thought is going to lead to feelings of anger, which is going to lead to behaviors, probably her being punitive or him being punitive. But let's take the same situation, Johnny kind of being disruptive, and the teacher says to him or herself, oh, Johnny's got ADHD. He's got this neurological issue that really makes it difficult for him to sit still and focus. That feeling, the feeling is now, instead of anger, might be more empathic, and the behavior will totally change. Instead of yelling at Johnny or punishing him, maybe that teacher will say, Johnny, come here. I have to hand these papers out to your classmates. Why don't you go ahead and distribute them? And getting Johnny up and moving and walking around. So the way you think about something, whether you think that Johnny is just a bad kid, unfortunately, teachers think that, or whether you're thinking that Johnny neurologically cannot sit still, the way you think about it changes what you feel and what you do. I just want to give another example because it was so telling. There's one family that I was working with where mom was so frustrated with her 8-year-old child because she has 4 kids. And whenever she'd pull in from the supermarket, her 8-year-old kid would get out of the car and always leave the car door open. And she would say, just close the door. You're 8 years old. You know how to close the door. Close the door. So in her mind, that was a won't. He knows how to close the door. He's just nuts. That's a won't. And she was that led to the feelings of anger. And that led to her behavior. She was basically yelling at him and punishing him. And what we realized was it really wasn't a won't. It was a can't. What happened was that one day the kid had closed the car door on his hands, and now he's terrified of closing the car door. So once we recognize that there's an issue there that's making it can't, you can treat that issue. You can teach him that skill, and then the whole thing changes. So when mom realized that, her feeling was more empathic, like, oh, that makes sense. And she became more nurturing, more supportive, and felt differently, which led to different behaviors. So thinking about it, I'm going to ask you to try to find alternative explanations, and that might help you feel better. And frankly, I don't care if the explanations are true or not. If you're making them up, they might make you feel better. So instead of thinking of either a child or a spouse or a boss as being rude or obnoxious, try to think of an alternative explanation. Like maybe they're having a hard day. Maybe they're not paying attention, or maybe they just don't know how to do something. Any explanation will do. And that might change the way you feel. And if the explanation you come up with, if the alternative is that they don't have a certain skill, then it's up, coach them, teach them how to have that skill, teach them what it is that you need them to do. So if your child is standing there and a peer walks by and says hello, when your child just kind of looks away and you're horrifically embarrassed, okay, one thing is that you could think of as my child is being rude, but let's think of an alternative. Maybe they're not being rude. Maybe they are just socially anxious. Maybe they don't know what to say. Maybe they didn't see the kid. But if it is something like social anxiety or not knowing what to say, then teach them the skill, coach them, role play with them, give them a script, make them feel more comfortable. So changing the thinking can change the way you feel, and will also change the behavior because it's going to make you more more empathic. That's the feeling, but it also will help you coach them, help them develop the skill.
So is there anything that a caregiver can do to prevent feeling so overwhelmed in general?
Without resorting to the white wine thing? Yeah, yeah, definitely. Yeah. Taking time out is really important. Social support is very important. Being with friends, being with family, enjoying family time. There's lots of research that shows that the more family meals you have, the healthier the family is. So if you could fit in 1 family meal a week, that's great. 2 is even better. The more you have, the better it is. So try to fit in the time with your family. But to prevent feeling overwhelmed, being organized helps, both at home and at work. Knowing where things are, that just takes another stress off of you, another layer off of your stress level. I know for me that when I lose my car keys, like my kids know not to talk to me because I am not in any condition. So I know that when I come home, I have to put my keys in a certain spot. And when my kids borrow my car, they know they better put my keys back because otherwise I will lose it. And actually, it's amazing how technology can help, because my kids recently bought me those tile things that beep when you lose something that it's attached to. So that helps. But the point is, organize yourself, know where things are. That can help you from reducing the feeling of being overwhelmed. Routines are important, both for you and for your child, and for your, if you're taking care of an elderly person. Routines are very important, but you also need to be flexible. It's not good when some things are so rigid, because life happens and you have to be able to go with the flow. I think that sleep was mentioned before. Sleep hygiene is so important. Making sure you're getting enough sleep. I'm going to tell parents, try to get off the phone at least an hour beforehand. The recommendation is really 2, but I know that so few people are willing to do that. And in terms of kids, I highly recommend that you have your children charge their phones outside of their room. I can't tell you how many times the kids' phones go off at 3, 4 a.m. Kids are texting and tweeting and this and that, and it's not good. So just make sure your phones are turned off, they're silenced, and if possible, get them out of the room so it's not even a temptation. Exercise is important. That should be part of your daily routine. Another thing that's important is just, finding the good stuff, finding the positive things. When we're overwhelmed, we tend to really focus on the negatives. We have to look for the positives, and we have to find them. And we have to appreciate them. So finding the positives is so important. And along those lines, when you see your children doing good things and you find the positives in your children, praise them, let them know. It's same thing with the spouse, a loved one. Find the positives and let them know that you appreciate them. And just to throw it in, their diet's important. What we're putting into our body is so important, and definitely has effect on the way that we feel and how alert, awake, the decisions we make. And diet does play a role in all that.
Speaking of diet, I'd like to ask Dr. Seminara your thoughts about optimizing nutrition.
Sure. So when you are providing care for an older person, optimizing nutrition is so important to really assure that you are doing everything you can to either recover from an injury, a surgery, or some other comorbid illness. So there are several things to keep in mind, especially for your geriatric patients. One is food consistency. Is the food of a consistency that the patient is able to swallow because of their dentition and their ability to swallow? If patients are not swallowing appropriately, they can aspirate, leading to pneumonia and other complications. So consistency of food is very important. I know that this is a challenge for hospitalized patients who are often put on very highly restrictive consistencies. And when they go home, making that transition and learning how to modulate to get those thickened consistencies for liquids, for instance, can be very, very challenging. There are, of course, certain restrictions which people do have to live with. Most importantly, I would point out to salt restriction for patients with active congestive heart failure. And so that is something that is probably going to be lifelong. So it's important to find other flavors to counteract what people feel like they're missing with salt. In general, I tend to be somewhat liberal with my older patients who have a desire for something that maybe isn't fully appropriate. The diabetic who just has to have pasta on Sundays or who loves to have ice cream on a Monday night in the summer. So I try to sometimes flip it and say, well, if you're going to do that, are you doing the other things that you also need to do in a proactive way? And for most geriatric patients, there's an issue with a lack of protein in diet. One of the syndromes that occurs when people get older is sarcopenia. They can lose a lot of muscle mass, they gain body fat, and in order to appropriately recuperate from injury or illness, they need to increase their protein stores. That's the only way to build muscle. You know, you can't just exercise, you have to lay down the building blocks that you need. So they can get protein from their diet from meat, fish, chicken, and beans. Unfortunately, a lot of people think, well, if I just eat vegetables, I'll be getting my protein. And it's, of course, vegetables are really important for fiber, for vitamins, but you can eat all of the zucchini in the world. It's not going to give you the protein that you need. So education is part of it. And then there are some very readily available protein supplements in the forms of powders that can be sprinkled on foods that people really readily enjoy. Many of them have no taste or flavor and very minimal consistency, actually. The protein powders are significantly improved in that way. So I encourage everyone to, go to GNC and pick the product that they feel would work best for them. There are supplements, and caregivers often ask about the use of, I'll just say Ensure to sort of represent them all. And they can be very helpful for adding calories and vitamins and other nutrients. But if a person has a working GI tract, I don't like to use that as a supplement for food. We can add it in between or as a snack at night, maybe mix it to make a malted with some milk or ice cream to enhance the caloric intake. But if they can eat, I do prefer that they eat food. Socialization is such an important part of eating. If they are alone, they tend not to eat so much. I have so many patients who were socially isolated, had started to lose significant weight. As soon as they were eating meals with family, their intake significantly improved. So think about that as well. And I would also say that if you have a person who has pressure injury risk, there are specific vitamins that can be helpful. So if they have pressure injury, vitamin C, 500 milligrams a day, very important. And also zinc for at least 2 weeks at 250 milligrams a day can also be a very important supplement to take.
Thank you for that. If I can just shift gears for a moment and ask both of you for your thoughts on becoming a caregiver by default. How can a person embrace the role? What can make it easier for them to do so? Either one of you, both of you, what are your thoughts on that?
So I will say that in my private practice, I certainly have had the caregiver by default issue with many patients and or patients' caregivers. And sometimes I'll have a family meeting where some of the challenges can be vented. Often the caregiver by default is more often than not a daughter who's in physical proximity to the parent. Other children may have hightailed it to California and Florida. And, the perception of the person who's behind is that, they left and they're having a great life and I'm not. And so that's where really getting together and talking about what the real needs are is important. For instance, if there are 2 or 3 siblings and only one is providing care, it's not inappropriate to ask the others to make certain provisions. For instance, financial assistance. The person who's providing the care shouldn't by default be the person who has to provide all of the economic support. That may be a tremendous burden for their family. Also, the person providing primary care, I think, has the right to lay down what time they need with their family. It's okay to say, I need 1 weekend free a month to spend with my family. And I don't want to hear from anybody unless that house is on fire or going down, It's okay to take some time. I need 2 weeks every summer. It's going to be at this time. My other siblings, you need to step in and take over that time. And often by asking, you'll receive. If you don't ask, the assumption may be they can handle it. They want it. It's okay. So I really encourage a conversation with other family members who should be contributing and haven't been. And often if you ask, you'll get something. I'm sure, Jill, that you have some recommendations about supportive care and group therapy for these problems too.
No, absolutely. But I think that what you said about asking is so important. So if you have a single parent who's trying to get everything done, it's hard. So you need to ask other people for help. And it might be, your neighbor's going to the supermarket. Can you pick me up a bottle of milk? I mean, that's so helpful. So it's you need to rely on other people, not just for that actual help, in terms of resources, but also rely on people to have fun. Get out there, have some fun, enjoy yourself. You need to take time out for yourself. I know it's very hard to do. In my group, what I do is I do have an assignment where I ask parents to take 15 minutes a week just to do something nice for themselves. And so few people are able to do it. It's so hard to do, but it is very, very important. And if you are caretaking, we know there's a lot that has to get done during the day. I would recommend picking your battles, choosing carefully. So maybe the laundry doesn't have to get done today. Maybe you could do that tomorrow. You can't get everything done. But I think that what you said is that there is help out there, whether it's neighbors, whether it's siblings, but there's also resources such as, within the health system. There's wonderful therapists out there. There's wonderful group programs. So try to seek it out as much as you can. I will say that I think that right now it is difficult to find psychologists that are available. But the bad news is that because so many people are in need, their time is filled. But the good news is that so many therapists are now doing the work on telehealth, which makes it much more accessible. So try to find that help. Try to reach out that way if you feel that would be beneficial.
Oh, that was great. Thank you so much. You've both given such practical and actionable guidance today. I'd like to close by asking each of you for one takeaway that you'd like to emphasize for our viewers. Start with Dr. Sonnenklar.
Okay. There's so much you could take away, but I think the most important thing would be to basically find and focus on the positives in our lives, as we navigate through challenging times and through the challenges of being a caregiver. Find the positives, notice the positives, appreciate them, point them out to others, point them out to yourself, find them.
That's great advice. Jill, it really is a little prayer of gratitude every day, I think can go a long way for sure. I think also that attention to self-care and to what matters most to the patient's health, to them individually, and to their function can really lay the framework for a very successful caregiving experience. It takes some organization. Not everything can be done in one day, as Jill pointed out, but I think that with a positive attitude and with good organizational skills, this can be achieved.
Thank you both so much for all these wise words. And thank you to our audience for taking the time to be with us this afternoon. Have a wonderful day.
Hello and good afternoon. I'm Dr. Sotiri Polidoru. I'm an associate professor of medicine and psychiatry at the Zucker School of Medicine, the medical director of addiction services for Northwell Health, chief of addiction medicine for the Division of General Internal Medicine, and the interim medical director at Wellbridge Addiction Treatment and Research Center.
Good afternoon, everyone. I'm Dr. Jean Morley. I'm an assistant professor at the Zucker School of Medicine and the Feinstein Institute for Medical Research. I'm also a primary care physician and a clinical researcher with my primary focus on the treatment of depression, anxiety, and alcohol use disorders within primary care.
Dr. Morley and I are very much looking forward to our conversation today about a topic that is both rather timely and relevant. Our session today is called Distilling the Facts, an analysis of alcohol benefits and risks. Alcohol use has been steadily rising in this country. Dr. Morley, can you tell us about general patterns of alcohol use and how they may have changed since COVID?
So thank you for the question, Dr. Polidoro. This is a great place to start. I think when each of us starts to think about the role that alcohol plays in our lives, it's really useful to have a context. If we look back historically since the end of Prohibition, our attitudes as a country towards alcohol have progressively become more accepting. Before the COVID pandemic, our patterns of alcohol use among adults have generally fallen into three major categories. In the middle is the largest group of us, those who drink somewhat regularly, but don't drink to excess and generally don't run into any trouble. Then there are those who don't drink at all, and that represents about 30% of us. On the other end of the spectrum, a little over 25%, 1 in 4 of us, are those who regularly drink above healthy guidelines. Now, alcohol use in that group is really on a continuum, from those who just drink, like mildly at-risk drinkers, to those with mild to moderate alcohol use disorders, to those with serious addictions. And not surprisingly, as the level of drinking increases, so do the health consequences. Now, more recently, trends since the COVID pandemic started show a significant uptick in alcohol use, especially among women. Overall sales of alcohol have increased by about 50% during the pandemic, and online sales by a whopping 500%. Recent surveys show significant increases in alcohol use. However, the amount tends to vary from as little as 15% to as high as 60%, depending on who's being surveyed and how the questions are being asked.
Thanks, Dr. Morley. I mean, that's really helpful to, assist us in thinking about the continuum and the kind of historical perspective of how things have changed. Historically, though, heavy drinking has been usually more associated with men. However, alcohol use among women has increased since COVID. Can you tell us a little bit about that? Is this a new trend?
So you're quite right. Alcohol use among women has unfortunately increased during the pandemic, but the trend towards higher levels of drinking among women is not new. It really started about 20 years ago. In the 10-year interval from 2002 to 2012, there was a 15% increase in the proportion of women who drank, a 60% increase in heavy drinking among women, and that's compared to only about 16% increase in men, and even more concerning, an 85% increase in the diagnosis of an alcohol use disorder among women. More recently, in a survey just prior to COVID, 60% of men and just over 50% of women reported drinking in the past month, while 30% of men compared to 22% of women recorded binge drinking. Now, these numbers are just not that far apart anymore. So, although in absolute numbers, there still are more men drinking heavily than women, as you can see, the gap between the two has been steadily shrinking.
Thank you, Dr. Morley, for noting these changes. How has COVID impacted this trend in alcohol use among women?
So it's a great question. So alcohol use among all groups has increased during COVID. However, again, women have really disproportionately been affected. One recent study found that women have increased their heavy drinking days by 41% since COVID began. Now, turning to alcohol is a common socially acceptable response to coping during times of high stress. We've seen similar increases in substance use after other traumatic events, like Hurricane Sandy or 9/11. But the pandemic's been unique, both in its duration and in how profoundly our lives have changed. Much of the responsibility to manage the logistics of these changes have fallen on women, who often have to deal simultaneously with working from home, childcare, household responsibilities, homeschooling, financial pressures, just to name some. Compared with men, women have reported higher rates of pandemic-related stress, including changes in mood, sleep, productivity, health-related worries, and frustration with the isolation and the loss of social support. Women with children under the age of 18 reported the highest levels of stress. So there's no question, While we've all experienced hardship in the past 2 years of COVID, the higher levels of stress reported among some women and the increased access to alcohol during the pandemic have proven to be an unhealthy combination.
So important to comment on the different strain that so many have gone through, and really we've all gone through during COVID. There's certainly a difference between drinking to unwind at the end of the day in moderation, or to celebrate a special occasion, to drinking to cope with a specific event or stressors. Can you elaborate a little bit more on what might be considered a safer amount of alcohol to use? And then also kind of how excessive use can really impact you, both your physical health as well as your mental health.
Yeah, so I'm happy to clarify this. So healthy guidelines regarding alcohol use for women are not more than 3 drinks on one occasion and not more than 7 drinks for a week. And these guidelines are also true for men over the age of 60. Healthy guidelines for men are not more than 4 drinks on one occasion and not more than 14 drinks per week. Now, to really understand these guidelines, it's also important to understand what constitutes a standard drink, because it's not necessarily the size of the drink that matters, it's the alcohol content. So 1 12-ounce can of beer, 1 5-ounce glass of wine, or 1 shot of spirits, which is 1.5 ounces, all contain the same amount of alcohol and are considered a standard drink. Now, the higher we go above these guidelines, the greater the health consequences, including heart disease, liver disease, certain cancers, gastrointestinal issues like ulcers or gastritis or pancreatitis. Heavy alcohol use also increases risk of falls, motor vehicle accidents, domestic violence, and gun-related violence. In addition, heavy drinking can negatively affect mental health by worsening insomnia, anxiety, or depression.
So Dr. Morley, there is research that women are more susceptible at times to these negative health effects from alcohol due to some biological differences between women and men. Can you tell us a little bit, maybe that is why some of these guidelines are different, or how we can kind of interpret some of those changes, those differences specifically?
Oh, that's a question I often get asked by my patients. Because women absorb and metabolize alcohol differently than men, the guidelines for healthy drinking are different. However, there is a caveat, because even at weight-adjusted lower levels of exposure, alcohol consistently is shown to have more negative effects on women's health than on men's. Because women typically have less total body water and high total body fat, alcohol is more concentrated in women's bodies.
Are there any exceptions to some of these recommendations or general guidelines that you noted?
Yeah, I'm really glad you asked that question, because in some instances, there's no safe level of alcohol. For example, women who are pregnant or trying to become pregnant should not drink at all. Women with cancers, such as breast cancer, or anyone with head and neck cancers, liver or colon cancer, lung cancer, shouldn't be drinking. And then people with liver disease, heart disease, diabetes should severely restrict their alcohol use or abstain from alcohol completely. And then there are certain medications that are just not safe to mix with alcohol, like pain medicines, anti-anxiety medicines or sleeping pills, blood thinners, diabetes medicine, some antibiotics, and some blood pressure medications. So if someone's taking a medication and they're not certain if it's safe to drink or not, be sure to speak to your doctor or your pharmacist.
Thank you, Dr. Morley, for noting those important exceptions. Certainly there would be others that any person can speak to their physician about as well, but just noting a number of those exceptions is just really helpful to think about. In the circumstance where someone may realize that they are drinking in an unsafe way, perhaps they're finding it difficult to reduce some of their drinking. Can you talk a little bit about some of the treatment options for alcohol use disorder and what they might be in general?
Yeah, absolutely. So for anyone who has concerns about their level of drinking, there are both behavioral health interventions and medications that have been proven effective in the treatment of alcohol use disorder. There are 3 FDA-approved medications that can be given in both primary care and specialty care settings. And we also know that combining behavioral health support with medication improves the likelihood that people being treated for alcohol use disorder can both achieve and sustain their goals. Now, like high blood pressure or diabetes, alcohol use disorder is usually a chronic medical problem, so it really helps to think of it that way. Just as you'd expect to partner with your physician over years to manage your diabetes or your high cholesterol, alcohol use disorder is no different. That's why I think primary care physicians are in a unique position to be effective and compassionate partners in this kind of care. Many patients can safely manage their alcohol use disorders in a primary care setting. However, those with severe addictions or extremely heavy use would likely require more intensive treatment in specialty care settings. Now, Dr. Polidoro, given everything we've discussed so far, what do you make of the data that suggests modest amounts of alcohol can be beneficial?
Thanks, Dr. Morley. Yeah, that's a really important point that we can talk about and try to clarify. And in some context, it's important to say that alcohol and other substances can have some limited beneficial aspects at times for some people, even though it remains, incredibly important that we can still appreciate the risks that are present as well. So while alcohol in some or limited amounts may possibly have some supportive evidence suggesting a cardiovascular benefit related specifically to heart attacks, we really should also recognize that that in itself is not the whole story of alcohol's effect on your body. It could be helpful to also keep in mind that even those studies that previously suggested there could be some benefit, the amount of alcohol consumed was rather small and limited. However, Dr. Morley, you mentioned this earlier, what is clear is that as drinking increases, the risks dramatically increase as well. And this evidence is very clear and consistent. The risks that have been identified include varial cancers, so oral, esophageal, pancreatic, liver, breast, colon, lung, all would be kind of considered. Let me also note that, more recently, the American Cancer Society has identified that alcohol is one of the stronger cancer connections to specifically breast cancer. So over 10% of new breast cancer diagnoses are related to drinking alcohol. So really, since 2020, the American Cancer Society guidelines recognizes that even a single drink appears to increase the risk of cancer. So they have been advising complete avoidance of alcohol for cancer prevention specifically. So again, just different aspects for us to be considering. Other factors really to be reminded of as well, such as the risk of injury, and not just from accidents, but violence and suicide increases as well. So really, we should consider many factors, balancing both some of the benefits, but also the number of risks that we started to talk about.
So that gives us an awful lot to think about. Now, we've talked about what options are available in primary care. What about those seeking treatment for alcohol use disorder in a specialty setting? Can you tell us a bit about what the path to recovery looks like and how you help your patients?
Sure. So certainly each person's recovery is unique. It's important to recognize that we have many treatments, though, including specific medications that are currently available for various substance use disorders. So not just only alcohol use disorder, but others as well. And that our treatments work really as well as treatment for other chronic illnesses, like again, hypertension and diabetes. Also, like other illnesses, treatment can look differently based on the severity of the disease. So, as an example, for a person with a severe alcohol use disorder or another substance use disorder, there may be beneficial to have a period of being in the hospital or a residential setting, or more regular and frequent assessments at an outpatient or ambulatory specialty clinic. All of those different care environments may really be needed and supportive of a person's recovery. However, for many people who continue to stabilize, less frequent and less intense treatment can really be the optimal form of treatment that they need. So similarly to ongoing monitoring by your primary care provider, also similarly to other areas of medicine, more recently, the adoption of telehealth visits, particularly since the beginning of the pandemic, has been really widely implemented across not just medicine more generally, but even within specialty addiction centers as well. And that can be a really important way to access treatment during the pandemic and going forward. There's also a growing focus on the role of digital therapeutics as an additional avenue for receiving and connecting with treatment. So, our scientific understanding of substance use disorders, as well as a treatment option, has really continued to grow rather dramatically.
Oh, thank you. Now, along similar lines, just to build on this, what if it's not ourselves, but someone else we're concerned about? What signs can friends and family look out for to recognize if a loved one may be struggling with a substance use disorder? And then are there resources available to help them access care?
Great question, Dr. Morley. Yeah, that's an area that, all clinicians are faced with very regularly in terms of what kind of support is available, and not just uniquely to treatment of the person who may be going through that experience individually, but also their support system, family, friends, loved ones. So, the first step is really being aware if a person is using an addictive substance regularly, how it may be affecting them socially, their behavior, or their health. And, having an open, non-judgmental conversation about it is really an important step. There are certainly a number of resources available. There are national resources that are open and available to everyone. Some are available online, so findtreatment.gov, FIND treatment, TREATMENT.gov, or the National Helpline, which is a telephone number, 800-662-HELP. Again, 800-662-HELP. Both are provided by the Substance Abuse and Mental Health Services Administration and can help those personally looking into treatment options, as well as loved ones or family members interested in finding out about resources. Within New York State, there's a New York State resource that's also available by calling 877-8-HOPE-NY. So 877-8-HOPE-NY. Or texting to Hope NY, and that number at Hope NY is 467-369. Additionally, Northwell offers a screening, brief intervention, and referral to treatment service, and that's available by calling 516-465-5955. Again, that telephone number is 516-465-5955.
Well, thank you for sharing all those resources with us. Can you suggest some things we all can do to better understand and support those who are struggling with substance use disorders?
Great question. I'd certainly recommend continued conversations like this and suggest it's less about having all the answers, but instead it's about engaging in an open, non-judgmental way and recognizing that treatment is available, accessible, and very effective.
Great. Well, thank you everyone for taking the time to join us today. We'd like to introduce now our colleague, Dr. Nizan Roth. She's the director of Women's Liver Health Program, who'll speak to you now about the impact of alcohol use on your liver. Thank you again.
Hi, my name is Nizan Roth. I'm a transplant hepatologist and assistant professor of medicine at the Donald and Barbara Zucker School of Medicine at Hofstra in Northwell, and the director of the Women's Liver Health Program through the Katz Institute of Women's Health. I'm going to talk to you today about how alcohol can affect the liver and how we can try to prevent and manage alcohol-associated liver disease. I'd like to start off by just talking a little bit about the liver itself, my favorite organ. It really is a powerhouse within the body. It's responsible for over 100 different functions, and we don't have a way to replace it. There's no equivalent of liver dialysis if the liver fails. So it's an important organ to protect. It has jobs that include filtering the blood, storing a number of different substances in the blood, and also making a lot of very critical things for the body, ranging anywhere from storing glucose to making proteins and other clotting factors that you need. The liver is a smart organ. It's actually able to regenerate and heal itself when it gets injured by something, whether it's alcohol or something else. The problem and the challenge is that if injury continues, if there's ongoing damage to the liver that happens over weeks and months, and especially over years, eventually that can overwhelm the liver's ability to heal itself, and you can end up with permanent damage. So I'm going to speak a little bit more about how alcohol can be toxic to the liver. And without getting too technical, alcohol is directly toxic to liver cells. It leads to the development of fat within the liver cells. It also sets up a pro-inflammatory cascade, which leads to your body sending immune cells into the liver that then further attack and damage the liver cells. The alcohol also leads to effects on your digestive tract. So it affects the healthy bacteria and the balance of bacteria that live inside your intestines. It also can lead to more leakage of things like toxins through the wall of the digestive tract, and all of that can really exacerbate damage. Within a short time of binge drinking, or especially if somebody's drinking alcohol heavily over a few days or even a week or two, almost all the time, more than 90% of the time, there can be detectable fat that's indicating damage inside the liver, inside liver cells. The good news is that with quitting drinking, with alcohol abstinence, that fatty liver that comes from recent alcohol actually can be fully reversible within 4 to 6 weeks. So if somebody makes a mistake, drinks really, really heavily, and causes some temporary damage to the liver, your liver can really heal from that pretty nicely. But I like to make an analogy to patients that it's a little bit like if you burned your arm in the same place. So maybe the initial burn heals, and then you get a little bit of scar tissue, but it looks okay. If you keep injuring yourself in the same place, eventually you accumulate scar, and it doesn't look normal anymore. And the same thing happens in the liver. So when there's this ongoing process of damage and healing over the span of 5 to 10 years, people can end up with cirrhosis, which refers to when there's permanent scarring and a disfigured liver. And that's when you can start to have symptoms because of the liver not being able to keep up with its many important jobs, or because blood has difficulty flowing through the liver, and that leads to the symptoms of liver failure. Alcohol is also unique in that even if somebody doesn't have extensive scar tissue in the liver, even if the problem hasn't been going on that long, a lot of alcohol consumption all at once, truly sort of excessive amounts for the health, can lead to a short-term problem that's called alcohol-associated hepatitis. And that refers to sudden and tremendous fat and inflammation that can happen in the liver and even lead to liver failure. We see this sometimes in men and women who were previously healthy, didn't have any idea that they had any medical problems related to alcohol. But when the alcohol consumption has been really excessive and too much for their health, all of a sudden the liver can get very sick very fast. And that can be life-threatening. So I've spoken a little bit so far about all the ways that alcohol can be toxic and can lead to liver health problems. Let's talk next about what is a safe amount liver-wise. Does this have to be complete abstinence, or, can drinking in moderation be okay liver-wise? The truth is that it depends. You've already heard a little bit from my colleagues about how men and women metabolize alcohol differently, and that's very true. There are a number of other factors that also affect how much alcohol can be drunk safely. Some part of it's genetic. There's a number of mutations that have been identified by researchers that predispose people to developing alcohol-related liver disease. If you've had previous bariatric surgery for weight loss, for obesity, things like a gastric bypass surgery, that also dramatically impacts how alcohol is processed and absorbed into the body. And the risk of developing alcohol-associated liver disease is much higher and happens at much lower levels of alcohol consumption. The way that you drink alcohol also matters. It's not just a matter of amounts. So drinking on an empty stomach or while fasting, binge drinking, all of these patterns have a higher risk of leading to liver disease. If you have other coexisting liver conditions, whether it's viral hepatitis like hepatitis B or C, or what's really common in the US, which is metabolic fatty liver, so fatty liver that comes from non-alcohol related reasons, but things like obesity and diabetes, that can also really lower the liver's tolerance for alcohol. One little bit of good news in terms of things that can lower risk of alcohol-related liver disease, coffee consumption can help. So if you're a coffee drinker, great. And if you are drinking alcohol, consider having a cup of coffee along with that, or, near that time. But let's talk about some easy rules of thumb. So for women who are otherwise healthy, who don't have other forms of liver disease or any known liver disease, drinking up to 1 standard drink per day and no more than 7 standard drinks per week is a safe threshold where you're not going to develop any alcohol-related liver problems. For men, it's double that. So up to 2 standard drinks per day and no more than 14 in a week. However, if you do have risk factors for non-alcohol related liver disease, so if you have obesity, if you have viral hepatitis, if you're diabetic, if you have known liver disease, you may not be able to drink even the amount I just told you. And so a good rule of thumb is to cut that down by at least half. So maybe it's only 1 standard drink every other day. And for somebody that has prior bariatric surgery, likewise, half of what I said. So 1 standard drink every other day at most. If you're somebody who already has cirrhosis, who already has extensive scar tissue in the liver or serious liver disease, then unfortunately, it really should be total alcohol abstinence, because at that point, the liver really cannot do well with any amount of alcohol, even in moderation, and continued drinking can really lead to progression of liver disease, worsening symptoms, liver failure, and also it has a lot of very real implications in terms of whether somebody can receive a liver transplant if that ever were to become necessary. We've talked about a safe amount of alcohol that you can drink, or who can drink alcohol safely. let's talk about how you can find out if you or a loved one has alcohol-related liver disease. Probably the most important thing to realize is that a lot of times there won't be any symptoms of alcohol-associated liver disease until it becomes very severe, until there's advanced cirrhosis or until you have that disease that I mentioned, alcohol-associated hepatitis. Earlier stages of alcohol-associated liver disease where there can already be fat, inflammation, and even scar tissue in the liver are oftentimes symptom-free. So you really don't want to necessarily wait until you're having physical signs of liver disease. What are those signs that can happen when you have later stages of liver disease? Well, some of the signs can include things like jaundice, which is yellowing of the eyes or skin, swelling with fluid retention in the abdomen or in the legs, confusion, shortness of breath, or bleeding from the digestive tract. But like I said, we don't want to wait for those things to happen before thinking about liver health. Luckily, there's ways to check to see whether you have earlier stages of alcohol-associated liver disease. A primary doctor can check blood work that includes liver chemistries. That's done on routine blood tests. And if those liver enzymes or liver tests are elevated, it'd be a good idea to seek the advice of a specialist, a hepatologist, or a gastroenterologist. A sonogram or an abdominal ultrasound can also be a good way to look to see if there's any fat in the liver that's related to alcohol, or if there's any abnormal shape to the liver that suggests cirrhosis. Finally, I'd like to mention another tool that we have, which is something called elastography. And this is a non-invasive, non-painful technique that uses vibration waves through the skin using a wand that looks very much like an ultrasound probe. And it's used to see what the density is of the liver. A normal, healthy liver should be nice and soft, like a raw chicken breast, or like a piece of liver that you'd find in the supermarket. On the other hand, if there's a lot of fatty inflammation in the liver, or if there's scar tissue in the liver, then those measurements of the density of the liver become thrown off and the liver becomes harder. And that measurement can tell us when we need to worry that somebody really has some ongoing damage in the liver that we want to work to try to reverse. All of these tests that I mentioned can often be done before you even are referred to or see a specialist. So it's relatively easy to get this checked by your primary doctor if you or a loved one are worried that you're drinking an amount of alcohol or were drinking an amount of alcohol that's above the thresholds that I mentioned to you that are safe for the liver. Finally, I'd like to talk about treatment. And it's important to recognize that at any stage of alcohol-associated liver disease, we do have treatments available. It is never too late to work on and improve your liver health. For people that have early stages of alcohol-associated liver disease, where it's mainly just fat or maybe some fat and inflammation in the liver, and at most only a little bit of scar tissue, that can be fully reversible, meaning curable completely, oftentimes with just stopping to drink alcohol. So when I see patients who have early alcohol-associated liver disease, the focus of my treatment is mainly on helping them to try to abstain from drinking or to moderate their drinking. This is where the work of my colleagues, Dr. Sateri and Dr. Morley, becomes so critical as well. And we really partner along with their teams. For patients who do have more advanced stages of alcohol-associated liver disease, including cirrhosis or alcohol-associated hepatitis, stopping to drink can actually still lead to some reversal of disease. So I've had many patients who start off incredibly sick, jaundiced and with all of the different symptoms and signs of liver failure that I mentioned to you. And while it can be life-threatening in some people, I have had some patients where with the right supportive care and with stopping to drink, they can have dramatic improvement in their liver disease and resolution of a lot of those symptoms. Sometimes we need to help that along with medications. In particular for alcohol-associated hepatitis, when you have that sudden onset of liver failure, medicines such as steroids given in the hospital or at home can be helpful in reducing that inflammation in the liver and giving the liver time to try to heal itself. We're also involved with clinical trials for other experimental therapies to try to help that disease and save people's lives. And finally, even patients who have cirrhosis or advanced stages of cirrhosis where we can't hope to necessarily cure the disease anymore, we still have the option of liver transplantation. And that could really be life-saving and life-changing for a lot of people who have struggled with alcohol. So again, I just want to emphasize that it's really never too late to think about your liver health, to try to moderate your alcohol consumption, to look into getting screened for alcohol-associated liver disease if you're worried that you've been exceeding safe amounts of drinking for the liver, and to get help from a specialist if you think you need treatment to try to help your liver health improve. Thank you so much for letting me speak to you today. It was my pleasure.